Okay, good morning, everybody. Thank you for joining us. This is our sixth Take a Stand for Caregivers CEU webinar. My name is Robin James, and I serve as the Development and Marketing Director for the Middle Alabama Area Agency on Aging, also known as M4A. And I'm very pleased and proud to present two of our speakers and presenters this morning to talk about Alzheimer's disease and related dementias. Our first speaker is Miller Piggott with the Alzheimer's of Central Alabama. She really is, I hold her at the highest regard as an expert, and she's been a great partner of M4A and the Aging Network across the state for several years. She is the Executive Director, again, of Alzheimer's of Central Alabama. We also have Jennifer Fuller, who I work closely with. She is our RN, Registered Nurse Supervisor, and she is the project director of our PANDA project. And so she's going to present information about the help and services provided through this new grant. And I also wanted to recognize and thank Carlette Smith with Human Resource Options. She has partnered with M4A to provide the CEUs, the continuing education units for these classes. So thank you, Carlette. And just to let you know about some other upcoming CEU classes we have scheduled, November 4th, we'll be managing your chronic medical conditions. A lot of our attendees in these webinars really wanted to hear about that, so we've got some great speakers lined up. On November 18th, we will have a how to deal with resistant behaviors, specifically for Alzheimer's and dementia. And just real briefly, I just wanted to remind everybody that Alabama's Aging Network, we operate in every county in the state. Every county in the country is represented by a local AAA or Area Agency on Aging. And our overall mission is to age in place or help folks age in place within the community. Every AAA in the country has a not a new business model. It's been around for quite a several years, and it's known as the Aging and Disability Resource Center. And the ADRC serves as a single point of entry for all long-term care support and services. So when a consumer of any age reaches out to their local AAA, including M4A, we will screen them for all benefit programs and services, and also connect them with resources. So we always ask consumers of all ages to just start. If you don't know where to start, just start by calling your local ADRC. And for Alabama, it's a real easy number. It's 1-800-AGE-LINE, and it will go directly to your local AAA. Some of the core programs and services we offer, we're really well known for the Meals on Wheels program, but it's actually called the Elderly Nutrition Program. Most of our programs are federally funded, and this just gives you a snapshot of, during Medicare open enrollment, we work with Medicare beneficiaries. We provide free counseling, plan comparisons all throughout the year. So that's a really busy time right now for all the AAAs who have the Medicare counseling program. We have a prescription assistance program, which is funded by the state legislatures. It's called Senior RX, but actually it's for any age, and especially the 55 and above population who are uninsured or underinsured. We have a federally funded caregiver support program, and you could just see all the other programs that we have available. I just briefly want to highlight our senior employment program. We cover Blount, Chilton, Shelby, St. Clair, Walker counties for all of our programs. And for this particular program, we are the administrator across Jefferson County. It's known as the Senior Community Service Employment Program. We call it CSEP. And it is a community service and work-based training program for people 55 and above. And it's the only federally funded senior employment program in the country that's funded by the U.S. Department of Labor. This program has literally changed people's lives. There's a lot of widows and widowers who are just looking for something to do in their retirement. They are socially isolated. Maybe they struggle financially because of their life change. And so they join this program, and it's a 2-year placement program, and it really can be have life-changing impact. So it's really great, and there's more information about it on our website. It's real easy to make a referral, if you don't want to call M4A and refer somebody or a loved one for help, you can just go to our website at m4a.org, and there's a button at the top, and you can just it's a real easy process to make a referral, and then our ADRC will follow back up with them. This is our contact information, and again, you just start by calling M4A for those 5 counties that I mentioned, and if you have not signed up for our weekly e-newsletter, you can do that on our website as well. So we will show, this is a 1.5 CEU webinar. We will provide the link at the end of the class, and we'll also put it in the chat box. And so I'm just gonna stop sharing my screen, and I'm gonna turn it over to Miller Piggott.
Good morning, everybody. My name is Miller Piggott, and I'm the Executive Director of Alzheimer's of Central Alabama, and I want to thank M4A, and especially Jennifer and Robin, for inviting me to speak for this webinar today. I'm going to start with, I'm going to jump around just a little bit because I want to start with some statistics, but right here up front, I want to tell you and share with you what the overall theme is today, the lesson I want a caregiver or anybody dealing with an elderly loved one who is beginning to have problems of any kind, and that is, when you fall, tuck and roll. I mean, what the message is about caring for a loved one with dementia, loved ones in general, is that we all make mistakes, we all have problems, but there are lots of great resources out there that can help us. So when we stumble, we've got to quickly pivot, we've got to move on, we've got to look for those resources that can be most beneficial. And I thought Robin's introduction was really helpful in reminding us about the great resources that the area agencies on aging provide, whatever county that you're in. But those of you who live in M4A's counties, y'all are so fortunate to have these folks that are working really, really hard to make a big difference for you. Okay, let me move forward here. Now, the first question that, I am asked nearly universally when I give a talk is, what's the difference between dementia and Alzheimer's? So let's just start right there, and then we'll all be talking on the same page. Now, I may use those words interchangeably because people who have dementia, they fall under what we call a wider umbrella. More people have dementia than have Alzheimer's, but Alzheimer's is one type of dementia. So what I hear people say, if you're looking for a way to understand it, it's like saying, I have a headache, I have a backache. That's what dementia is. It's describing the symptoms that you're seeing, but it's not a specific diagnosis. A specific diagnosis is like, I've got a slipped disc, and or my headaches are caused from sinuses. I mean, where the specific cause. So there are lots of different things that can cause dementia. Alzheimer's is the most common. And, we all need to be aware, Alzheimer's is really like a societal time bomb. I mean, before COVID took over all talk of any kind of medical condition, as it should. I'm not saying that it shouldn't, it absolutely should. But, this was Alzheimer's time to shine, so to speak. I've been doing this for 30 years, and 30 years ago we were like, certainly we were going to have this thing licked by now. I mean, I thought I was working in a business where I was going to put myself out of business, so to speak, and that's not what has happened. And we have got a long way to go still, and that's why I think it's so important for us all to be aware and knowledgeable of what Alzheimer's and dementia are. Now, every 35 seconds, someone in America develops Alzheimer's. This number is growing exponentially, and so we've got a lot of people around the globe, around the country, and particularly in our state, who are dealing with Alzheimer's or dementia. Oh, sorry, y'all. Okay, now the deaths from Alzheimer's have really increased, and this is an interesting statistic. Alabama has the 3rd highest death rate of Alzheimer's disease of any other state. So Alzheimer's is a really huge problem here in Alabama, and you can look there and you can see these other conditions where death rates have dropped, while our death rate has really skyrocketed. And so what we see is that an investment in research really does help in having better outcomes for families in terms of living longer. And so our investment in Alzheimer's research has lagged, if y'all can believe that, but it's beginning to catch up, and that's a really great benefit for us. So there's no FDA approved disease modifying therapy for Alzheimer's, but we've got almost under 100 drugs that are in some stage of drug approval. And we had a major setback last year, and that's what kind of the story of Alzheimer's is. It looks like we've got something promising, and then the drug company finds that they need to pull that back a little bit, and then they move forward again. And so that's kind of where we are. But hopefully we're going to have something approved for the treatment, because when you think about not having a treatment, or the last approved treatment was in 2004. I mean, imagine all of the other illnesses like cancer that has seen just really life-altering advances, in the past 15, 16 years. And Alzheimer's just has not gotten there, and it's time for us to catch up. So this is also interesting, and this is a short list. This is not a long list, because I see all kinds of articles coming out where they're looking at the causation and prevention of dementia. And so some of these things we can really control in our life, some of these we cannot. But it is important for us to note that there's growing acknowledgement that if we mitigated our lifestyle factors, we could reduce our risk of developing dementia or Alzheimer's by 30%. Now, there are lots of us like me who have a genetic predisposition. I've had family members on both sides of my family, my mother and then my paternal grandmother. So, that makes it even more important that I think about this list of things that might cause Alzheimer's. We hear a lot about head trauma. We hear that with football players, and that is certainly a concern. Midlife hearing loss. Now, some of us are in that category of having a loved one. I know my mother-in-law, who's 84, I think, and is suffering from hearing loss, but absolutely will not wear a hearing aid. What I got to say to those kind of folks is that is so old school, because things that improve our hearing are getting more and more high tech, less and less easy to detect or visible, and also I think we're going to begin to see costs go down. Late life depression, obesity, smoking and pollution. I mean, this has become a really huge cause of dementia, which is a real problem for our city dwellers, and particularly people who are living right now under the fire conditions that are going on out west. Physical inactivity, hypertension, diabetes, social isolation, and this is a big one we've got to be really aware of right now during COVID. And, this in and of itself is isolating, and we've got to be looking out for our seniors. And a lack of lifetime learning. It's not necessarily low income, because there are lots of people at low education. There are lots of people who didn't have access to school, but who proceeded to lead lives of lifelong learning. It's basically that the brain is a use it or lose it organ, and we all need to be doing what we can to learn new skills, to not live in a rut, basically, is what that means. Now, here's our problem in Alabama when we talk about that third highest death rate in the nation. These are the factors that lead us right back to that. We also lead in high cholesterol and obesity and diabetes and blood pressure. And I'm gonna leave it there and not say much more, but we all know if we're out there in the audience and there's places where we need to consider working towards a healthier lifestyle. So when did Alzheimer's begin? And I have to say, for families, sometimes that's hard to pinpoint, because the nature of the disease itself is that there are ups and downs. You know, there's a good day, a bad day, there's a good week, you know, and then something happens. And so when I tell people to think about when Alzheimer's began, it's when it really interrupted life. Now, these are two beautiful photographs of Philip and Kirsten, Morris and Philip. No, I'm sorry, I'm messing their names up. Kirsten and Philip, there we go, who are from Tuscaloosa and who have allowed us to share these pictures. You can see just the really dramatic change in her after her diagnosis of Alzheimer's. Philip is a was a very loving husband and provided excellent care for her. You know, it was a real struggle because of her youth and her seeming exuberance when she was first diagnosed, to convince her that she needed assistance, to convince her that an adult daycare was the right place for her to be. And, you know, she also was very much aware of her diagnosis. And I think that that places a particular burden on the patient early on when they have a great deal of awareness and insight in their condition, as she did. So when we think about the warning signs for Alzheimer's disease, there we go. It's that memory loss that disrupts daily life. It's not, thank goodness, just the little tiny little lapses that we all seem to have as we get older. It's just when we have instances where it is really a problem for us. Challenges in planning and problem solving, that may be something like trying to prepare a meal, you know, that requires us to go to the grocery store and buy the right ingredients and then get that meal all the way to the table. With difficulty completing familiar tasks, confusion with time or place, you know, and that's a big problem, I think, right now during COVID for a lot of us. We're living in kind of this weird vacuum where time doesn't mean exactly what it used to. But you know, if you have a difficult time with knowing what day or it is, it would be someone who, for example, turns up for church on a Monday. Trouble understanding visual and spatial relationships. This is why part of the diagnosis for Alzheimer's disease in that mini mental examination is to draw the face of a clock, because you've really got to be able to understand spatial relationships and getting numbers in the right place. Problems with speaking and writing, misplacing things and not able to retrace our steps. Decreases or poor judgment. You know, that's a real problem because, you know, for us, that's a judgment call if somebody's exercising poor judgment. It's when you see big changes, withdrawal from work or social activities, and changes in mood and personality, including apathy and depression. So that diagnosis for dementia, you know, what a physician or what the place where you start is ruling out anything that might be treatable. So that might be a UTI or chronic dehydration. You know, some of our elderly folks don't drink enough, particularly when it's hot outside. And adverse medications. Those are the kinds of things that we want to be sure that we've ruled out. And then, you know, many families start with their family physician, with their internist, and might even need a referral to UAB, to the Alzheimer's, the Memory Disorders Clinic. We are very fortunate to have this resource in Alabama. They were recently recognized as an Alzheimer's disease research center, one of a few in the nation and the only one here in Alabama. And this is a great honor for UAB and means that they're a wonderful resource for us. But that also means that it can take a while to get an appointment for diagnosis. And so families have to be prepared for that. And you can't wait until there's a crisis and then think you can get somebody in quickly, because that may not be the case. So, you know, when I say our universal theme today is, you know, when you fall, tuck and roll, I mean, this is kind of when it starts. You know, there's that initial caregiver's dilemma. I can't ignore it, but I can't fix it. You know, I can't figure out how to make this better. And so a lot of us, when we can't make things better, we do tend to ignore it. And of course, that's not a very good strategy. And so, you know, what I tell my families is that our job is to learn to manage it. And managing it often means bringing in those resources, like putting in that call to M4A and finding out what services you might be eligible for now and also down the road. I love this quote from Albert Cole. He says, "The shift from cure to care was an important decision for us. I realized my task was to manage life, while Virginia's task was to enjoy it." You know, I think that's really good advice for us on so many levels, because it's one thing to take care of someone who is got a condition where the good care we provide means they improve. But with our loved ones with Alzheimer's, this is a progressive condition that gets worse over time. And so what we have to remember sometimes when we have a good day is we have to rejoice and say, you know, this is the best it can be. And when we have a bad day and things don't go our way, that's when we tuck and roll. So the shift from cure to care is an important decision that I hope philosophically we begin to make, because that's what allows us to better prepare for the future and to manage life so your loved one can continue to enjoy it. Now, this is a list of concerns that came from newly diagnosed people living with Alzheimer's disease. You know, there's a movement now. People living with Alzheimer's don't want to be called patients because they don't consider themselves patients, particularly at the very beginning. And I think that's a real healthy attitude, because they want to live life as best they can. And sometimes they need our help to support them in doing that. So this list came out of a support group that was for people living with Alzheimer's disease: retaining self-confidence, overcoming feelings that others don't trust them, you know, coping with their need for additional time to absorb and understand what they hear. And this means our patterns of communication need to begin to shift and change, where we give them more time in a conversation before we bombard them with too much information. You know, giving them that sense of belonging and not being feel like they're left out. I have a lot of caregivers who say, you know, every time I get on the phone, there's my loved one. They're right there because they're afraid I'm going to talk about them. Well, you probably are talking about them when they're not standing right there. So of course they're listening in to hear what you're saying. Coping with independence, that they need to feel in control and independent. You know, identifying what they can do and what responsibilities they can continue is an ongoing challenge. You know, but you don't want to create a situation of learned helplessness, and we can do that if we take over too much. But at the same time, when you're thinking about things that are vastly important, like managing the checkbook, for example, or continuing to drive, those are things where you're going to need to be on the lookout for being proactive rather than just taking a wait and see approach. So the disease course on average from diagnosis to death is about 8 to 10 years, but we see many people living with the disease who live much longer than that. But this is sort of how I consider the stages of the disease, where someone progresses from needing supervision to requiring custodial care, where someone is watching them 24 hours a day, to that stage where they need nursing care. Now, that's not to say that they're in a nursing facility per se, but they need that kind of nurturing where we're managing every aspect of their bodily functions. These are two pictures of the normal brain and the disease brain, just because I think it's really helpful to see that there are physical changes in the structure of the brain. Dr. Richard Powers in the Alabama Department of Mental Health put together some brain books, and this is one of those side-by-side comparisons that are so helpful out of those pictures. So what is helpful here, I think, is to note that at least for right now, what is happening, our understanding of Alzheimer's disease at the most basic level is cells in the brain are dying. And once those cells die, the function that they served is lost. And so as more and more cells in the brain die, we begin to see more and more losses in terms of behavior and functioning. Y'all, this is a fabulous lady. Her daughter was a caregiver in my support group. This is Ruby. And Ruby is 80 years old when this photograph was taken. She was still active. She was a sitter. She was looking after a woman who was 102 at this time in her life. And she had been a giver and had always been very helpful to people. So that very early stage symptoms are when we're just beginning to see someone with memory loss and word finding difficulties, personality changes, getting lost in familiar surroundings, maybe not knowing how to get to the bathroom, at church anymore, or maybe even find the bathroom in their own home. Oh, now here's Ruby, her daughter. She moved in with her. And they enrolled Ruby in an adult daycare program, the South Highlands Center. Our adult daycares are amazing, amazing facilities where love and joy is freely given and exchanged. Now, Ruby attended adult daycare thinking that she worked there. Because she had been a natural caregiver and had been a sitter. So at first she thought she was just there to help the other folks. And in the beginning, she probably was. Our middle stage patients need custodial care, and that's really, really an important distinction, because this is when somebody needs to have their eyes on them 24 hours a day. Because you need to be very aware of them. This is not when they can be living alone. This is when we realize that has become too dangerous. They may be very agitated, hygiene declines, wandering and pacing become a problem. People who wander are actually trying to move away from the house. They're looking for something, maybe to go home. And Project Lifesaver is a program that is available to most of our caregivers. This is a bracelet that emits a radio tracking signal that can be very helpful. So again, this is why you need to be very connected with your community resources so that you're aware of things like that might be beneficial. Delusions and hallucinations, this is a real problem for many of the folks that attend the Zoom support group that I do. They've got spouses that see people in the house or see people outdoors and are very, very concerned. And that can be a real situation and problem. So our 4 A's of Alzheimer's, I think there's actually 5 here listed. 6 here listed, are really important for us to be aware of and knowledgeable of. There is a lack of awareness of their disability for many people. Now, for some, they do have awareness, but a lot of times families run up against problems when they've got someone who says, I can still drive, I can still manage my checkbook, I can still manage the pills that I take this morning, when we all know that they are not able to do that. And it's important to note that that's a symptom of the condition. And so rather than accepting their self-assessment, we've got to find ways to work around it. Now, memory loss amnesia, this is an inability to remember here and now. What's happening right now becomes very difficult for them to recall. They may be able to recall distant memories, however. Difficulty with things that they always have done body movement wise. This may be brushing their teeth, buttoning buttons. It's very small things that they may begin to fumble with, or not just have the rights to the body mechanics involved. Communication problems, aphasia. Most Alzheimer patients have more difficulty early on with their ability to comprehend what's being said, rather than their ability to speak clearly. Now, speaking clearly becomes a problem later on, but know that initially they may have difficulty understanding and responding to what's being said. And that's why speaking at a slower pace can be such a good strategy from the beginning. Agnosia is the inability to recognize things. That may be objects like recognizing that you're holding your toothbrush instead of a brush that you need to brush your hair with, but it can also be the inability to recognize familiar faces and even to recognize those that you love. And then finally, apathy, or a loss of initiation. And this is where, caregivers say, well, I can't get them to do anything. I can't get them up out of the chair. Now, some of our patients are up moving around too much, but there are many who have that apathy, that loss of ability to initiate an activity. So Alzheimer's disease causes global cognitive decline, meaning it affects all of our thinking and functioning. This quote is old as dirt. Now, that is about the year that we started Alzheimer's of Central Alabama, 1991. So this quote's coming up on its 30th year, and it's still in play. For every disturbing behavior, there is someone who is disturbed. Identifying who is disturbed may be the first step. So, if your loved one is having hallucinations, obviously that's a disturbing behavior, but are the hallucinations disturbing them? If your loved one is refusing to do something, but it is not hurting anything, do you have to force the point? I mean, I don't know. These are things that you have to make the call on in your own home. But sometimes caregivers are more disturbed than the loved one, and the caregiver is the one that's creating the problem. So, better to be kind than correct. There's a wonderful, wonderful family practice physician here locally, Renee Harmon, who's just released a teaching memoir about caring for her husband, Harvey. And she's got a chapter in there, better to be kind than correct. So we want to redirect where we can. We never want to rationalize and reason. That's a behavior that doesn't work. I had somebody in the Zoom support group this week, and this was, the real point that we had to hone in. She kept saying, I have more difficulty with my husband than her children do. Well, that's because she's correcting her husband, and that does not work. And we gave her some new strategies that'll probably be more helpful to her in providing better communication. What our goal as a caregiver is to defuse the situation. And when you rationalize and reason, you are only escalating the situation, and that doesn't work. So you want to keep things as calm and on as even keeled as you can. And oftentimes that means you're not correct, but you are correct in how you're caring for your loved one. Learning the Alzheimer's language. This is not reacting to the behavior, but responding to the cause of the behavior. This is just like when a baby cries and a mother knows the things to do to soothe that baby. It may be hungry, it may be wet and needs its diaper change. That mother goes through a list of things, and we need to think about and respond to our loved one in the same way, because they may need to go to the bathroom. They may be constipated and very uncomfortable. And rather than able to tell us that, rather than able to solve that problem themselves, they're showing us with behaviors their discomfort. So be very, very aware of the kinds of things that might help your loved one be more comfortable, so that their behaviors don't escalate. The ABCs of ADLs. ADLs are activities of daily living. So this is bathing, grooming, dressing, toileting, all the things that we all have to do every day for ourselves. We now begin to have to monitor or do for our loved one. So what you want to do is monitor as best you can for as long as you can. But when you realize they're going in the bathroom and then the water may be on, but they're not actually getting soap all over their body, then you begin to have to step in and offer more help. So be acutely aware of how your presence in providing intimate care comes across to them. You need to break it down. That means step-by-step instructions. You need to go very slowly. I'm going to brush your hair. Let me unbutton that. Let me help you take your shoes off rather than just grabbing somebody's foot and starting to untie their shoe. Calm, cool, collected communication is your major key here. You know, you want to stay as calm. You want to be cute, cool as a cucumber, basically. You know, when your voice spikes, they pick up on that more than anything else, and it really causes people with Alzheimer's disease to dig their heels in. Remember, you know, losing independence isn't fun. It wouldn't be fun for any of us. And so in order for them to allow you to help with activities of daily living, you know, they've got to trust you. And a lot of that trust is built on how you communicate. Oh, now here's Ruby, and you can notice a major change in her. Her daughter Joanne stopped coloring her hair. Now, about this time, they had a family reunion, and Joanne took her mother to the family reunion. She didn't know if it was a good idea or not, but when she got there, several of her cousins said, I just can't believe your mother, she's aged so much. You know, you're not coloring her hair. And Joanne thought, if you only knew everything that I was doing for her. Ruby has a colostomy bag, and this became a real problem. And so Joanne had to resort to this one-piece outfit for Ruby to make her colostomy care easier. So the final stage for people with Alzheimer's disease is nursing care. And as I said, that does not mean that it's being provided by nurses, because it's often provided by loving family members. But it is important to note at this stage that we need to be aware of resources that might be available to us, like hospice care. Hospice care can be a very wonderful benefit at the end of life. But it's not just end of life like they're going to die next week. You know, it can be end of life and it may be several months from now. And so it's important to work with your doctor to know when hospice care is right. But certainly patients begin to have more problems with those activities of daily living, and they begin to need escalating care. So here's Ruby at Alzheimer's of Central Alabama's walk a few years ago, and you'll notice that she's got her her doll with her, and her family said that, you know, the doll, the baby, had brought their family so much joy, and who would have thought it, because the baby doll meant so much to Ruby. And I think that that's what's most important, is surrounding them with the things that make them most comfortable and the loving touch that they need. I think there are ways to find positive aspects of caregiving, certainly personal fortitude and a sense of accomplishment. Finding meaning and finding hope from caregiving, you know, I think it is our choice to become embittered by the experience or to become enriched. And I'm so glad to see so many people becoming enriched. And one of the ways that they do that is to share their story with other people. You know, this is a very common experience, and their chances are that you've got neighbors that are going through this, you've got people at your church that are going through this, and if you can share what you've learned, if you can tell them about the services that helped you the most, you know, that's a great way to find meaning from the experience. And finally, as I said, we have been here for 29 years serving the 21 counties across Central Alabama and providing continence care. Right now, we're also providing insure. When the daycares are open, and let's all have our fingers crossed that that day's coming soon, we provide scholarships for people to attend adult daycare, and we provide the Project Lifesaver bracelets, especially here in Jefferson County. We've got a walk that's coming up. Our walk is a virtual event. It is always the first Saturday in November. So from November 1st to November 7th, we're just asking people to get moving wherever they are, because the more physically active you are, the more mentally sharp you will be. On November 7th, we'll have a drive-through. And please visit our website for more information. It's going to be so much fun with the Vestavia Marching Band. Miss Alabama 2008, Amanda Tapley will sing the national anthem. I'm telling you, it'll bring tears to your eyes, but there'll be food, fun, music, and entertainment. It'll be in a safe way. We certainly understand the importance of social distancing and wearing masks, because we know our folks with Alzheimer's are most vulnerable. So we'll be safe on November 7th and hope that you'll be able to join us. And again, thank you for inviting me to be a part of this webinar.
Thank you so much, Miller. What great information you shared. Thank you. Next, we're just going to have Jennifer Fuller, and she's going to go over all the services and program services for the PANDA project.
Thank you so much, Miller. That was such wonderful information, and it's always a pleasure to hear from you talk about Alzheimer's and dementia. So I am Jennifer Fuller. I am the project director of our PANDA project at M4A, which stands for Providing Alzheimer's and Dementia Assistance. This is a 3-year grant that we received. Started October of last year, so we just entered year 2 of our grant. We received $1.5 million for Shelby County from the Administration for Community Living. Part of our grant, we are targeting 3 different groups of people in Shelby County. It's people with dementia, older adults who have intellectual or developmental disabilities or are at risk of developing, because if people in the IDD population do have a higher risk of developing dementia. Those with Down syndrome have a higher than 50% chance of developing Alzheimer's. So it's really important to reach that group of people and really educate them on the importance of gaining that baseline assessment and being aware of the signs and symptoms. And then our third group that we're targeting are also the caregivers, because they take on so much in life and they really do need our support and help. PANDA brings together a diverse partnership of community-based organizations, advocacy organizations, faith-based groups, local governments, and university researchers to address the challenges of dementia and dementia caregiving. Our mission is to provide supportive services to people with dementia, older adults with IDD, and their caregivers. These supportive services help to improve their quality of life, promote independence, assist clients with remaining in their homes, and provide support and empowerment to help reduce hospitalizations and overall costs. The impact that we're hoping to have with this project is a collaborative and coordinated community response to dementia, improving our relationships with doctors and hospitals and healthcare providers all around the county. Increase quality of life for people with dementia through person-centered care planning. Reduce burden for caregivers of people with dementia, including caregivers of older adults who are at risk of developed dementia, and reduction in hospital visits and overall healthcare costs. Both at the start of this as well, since we've started this project, before we started and since we've started, we have developed a lot of partnerships, and I'm being told my slides are not changing. So let me see if I can fix that. Hopefully that's the right screen now. Sorry about that. So we have developed a lot of partnerships, as I was saying, with different people throughout the state. We are partnered with all of the major universities. We have a partnership with UAB and Dr. David Geldmacher and Dr. Rita Jablonski at the UAB Memory Disorder Clinic. The University of Alabama, we have Nicole Ruggiano, who is one of the social work professors there, and she is a great consultant for us. We're working with Auburn University and the School of Pharmacy there. We will be starting a medication therapy management program with them. They will have pharmacists looking at our clients' medication lists and looking for fall risks and things that are medications that are interacting with each other that may even potentially be causing their dementia to worsen. So there's a lot of exciting partnerships there, and we do expand that all the time. Some of the initiatives we are working with the city of Pelham, and they have started a Pelham Community Paramedic program. They have 5 paramedics that they have trained in dementia, and they are going into the homes and doing wellness checks and checking for fall risks, and just trying to make sure they have smoke detectors and carbon monoxide detectors, and trying to just make sure that, try to reduce those 911 calls because they get so many frequent 911 callers. We are also working with Asbury United Methodist Church. They had started a adult respite center back in October of last year, and due to COVID obviously had to close. We are hoping that they will be able to reopen in January. For in-person, they may have to have reduced attendance, but we're working with them and hoping that they'll be able to reopen, and they are doing things online as well right now. We already had a dementia-friendly program that we were, that actually Robin was doing, helping lead in our 5 counties that M4A covers, and we are going to expand that statewide with the use of funds from this grant. We have a healthy brain education program that ACL actually developed, and we will be doing those once a quarter, and it's a lot of great useful information on how to control your chronic conditions right now to help reduce your chance of developing dementia later in life. And we will be doing our first healthy brain education class online on November 9th, and we'll have more information to come about that. Robin, who is the head of our marketing department here at M4A, has been doing a great job of expanding our dementia campaign and just getting that word out and doing a lot of outreach with people in the community, both just citizens as well as healthcare providers. And then a huge part of our grant is also data collection and evaluation. As part of our grant, we were required to have a robust third-party evaluator. And so we are collecting so much data from this project on people who have dementia and just the differences that we are trying to make. And at the end of our project, we will put together a huge report, and we'll be able to share that with anyone who's interested. So we're very excited about that. So these are some of the services that we do in the home. We come in and we do a lot of case management. We do a lot of assessments, which I'll talk about a little bit more on the next slide. We will create person-centered care plans. We help provide respite care, homemaking services, and personal care if you need someone to come in and help them with giving baths. A lot of training and education. This Take a Stand event series that Robin has been doing is all part of this grant as well. We work with our elder law attorney, Jan Neal. She's done several of these and helps provide both education on a broad scale, as well as she will work one-on-one with our clients as needed and help get them any kind of legal assistance that they may need. Another big thing that we're doing is the remote monitoring technology. You know, I know Miller talked about the lifespan respite, or life alert respite, sorry. And that is a great thing. This is something that it doesn't track where they go outside of the home, but it tracks what they're doing in the home. So it's really, really great for someone who does live alone. They wear it on their dominant wrist, and then it's an AI technology, and it learns their behavior. So from the turn of their wrist, It knows what room of the house they're in. It can learn that how often they're eating, how often they use the restroom, they're bathing, they're sleeping, and it can use all of that and predict if they have a UTI or are at a greater risk of developing a UTI, or if they're depressed, or if they're at a greater fall risk, or even if they have actually fallen. It doesn't require them to do anything. If they're wearing that, it will pick up that they've fallen, and it will then alert their family care circle through an app on their cell phone. And then they can actually, that family member can call their loved one, and it goes right through that bracelet that they're wearing. So it doesn't require them to have to push a button. Though there is a button on there that if they just need someone, they can also just push that button as well. So we're very excited about getting that and using that in the homes of our clients. So, as I said, we do a lot of different assessments. So when we first go into the home, before we decide, we don't ever dictate what we're going to do. We do different screenings and assessments. We have a cognitive assessment. We use the Alabama Brief Cognitive Screener, or ABC. That's something that Dr. Geldmacher at UAB developed, so we are using that model. We have a quality of life for Alzheimer's and dementia patients screening that we do. It looks at 13 different areas in their life and asks them if they're able to, or their caregiver if they're not, to just rate those different areas and how they feel they're at. Part of our project is we're trying to help improve their quality of life. So we'll then reassess them in that every 6 months and hoping that we'll be able to improve some of that, at least some. We're also looking at falls. Falls is a huge problem with people with dementia, and we've seen a lot of our clients so far have had a lot of falls. And that is definitely something where Auburn University will come in with their medication therapy management program, and with the Pelham Community Paramedic program to try and reduce those numbers of falls. And as I said, we do a lot for our caregiver as well. And so we have a completely different program and assessment we do just for the caregiver, which is called TCARE. And this is a evidence-based program that we are utilizing, and a lot of people, it's actually now spreading worldwide. I actually just saw on their website that they have it in, I think, 9 different languages now. So it's a really, really in-depth look at where the caregiver is at. We initially asked them to do a screener on their own first, which takes about 10 or 15 minutes. We have our own exclusive website we can direct them to and ask them to fill that out so that before we even go to see them. So that then when we do come in the home, we already have a kind of a little snapshot of where they're at. It gives us a color-coded look at where they're at and their stresses and relationships, and if they seem like they're depressed. And then when we're in the home, if they did score high on that screener, we have a much longer in-depth assessment that we do with them that actually does take about an hour and even up to 2 hours sometimes to do, because it really does look at some of those more deeper questions. And it does look for things like that are good in their lives as well. A lot of people, when they are caring for their loved ones, they actually feel better about themselves, and they feel like they have more meaning in their life. So that is something else that we looks at it as well. It's not, just the negative things. It does look for the positive things as well. After we do the assessments, then we create person-centered care plans. And we have the one on the left side of the screen in purple. That's the one we actually do with the care recipient, the one with dementia. We break that down into a lot of different areas. So we help them create short-term goals, long-term goals, have plans for them with their activities of daily living. If they need help showering, if they want to take a bath or shower in the evening versus the morning. And this is all very, very person and family centered. So we'll come up with that plan together and we'll put that in this care plan. We're also looking at ways that they can get some social interactions, which obviously is a very difficult thing right now with everything going on in our world. but it's still so important. And so we'll look at different areas and different outlets out there. And as things start to open more, hopefully in the next couple of months, we'll be able to really expand on that and help encourage them get out in the community more. And then we also do a care plan for the caregiver. That is something else that is set up with TCARE on the right side of the screen. It looks at that thorough assessment we did, and then it recommends different resources in our area of places that we can help connect them with. If they seem like they are very depressed, we can help them find someone to go talk to, a therapist, and also to recommend talking to their own personal physician, because it's so important for the caregiver to take care of themselves as well as the person they're caring for, so that there isn't a burnout there with that. You know, another educational event that we're doing with our project, and Robin is actually helping with this one as well, is an elder abuse prevention workshop. And we'll be doing the next one of that next month as well. And we'll have all of that planned and get that out to y'all very shortly. And if y'all want to reach out to me and need more information, have any questions, you can reach me at M4A. This is our address and phone number. You can email me either at panda@m4a.org or jfuller@m4a.org. Always just call and ask for me. And if there's any questions, please let me know. That's it.
Thank you, Jennifer. Great job. We do have quite a bit of time, so please, we're going to open it up for questions that you have of Miller, Jennifer, or myself. And please ask questions, because you've got them front and center right here available right now. So,
Well, Robin, if I can talk just a minute while we're waiting, I would like to let y'all know that November is National Alzheimer's Awareness Month. And in addition to the virtual walk and then the drive-by walk that we're having November 7th, the statewide day of prayer for Alzheimer's patients and people caring for them is Sunday, November 8th. And you can find a copy of that prayer on our website. And we encourage you to work with your place of worship to see if that might be included as part of your services for that weekend. I think that's a really meaningful way to help families feel connected. And right now we all need as many connections as possible.
great, thank you. And I just wanted, because we do have a little bit of time, I do want to just talk a little bit about the PANDA grant. We had applied 3 years ago. This was our third application process, and hallelujah, we got it. But we had to show that we were already a dementia-capable delivery system, and there's just a huge federal process that goes with that. And so we feel like we really got it right this go around, and I'm so glad that we got the grant awarded. As Jennifer had mentioned, it is piloted in Shelby County, but all the different moving parts and partners, we have every intention to making it where it can be replicated in other parts of the state. And then I just want to talk a little bit about our dementia friendly. You know, there's a national dementia friendly movement, and I think it was started in Minnesota. And it's just been a really great, very simple concept where, and so what we did, we got back in late 2017, we got a very small seed grant, $10,000 grant, and we saw the need in our service area, but really across the country, where to train law enforcement and other first responders how to be dementia knowledgeable, sensitive, and responsive. And so Miller was very integral part of us developing that, as well as Dr. Geldmacher. And we put a toolkit together and a curriculum, and it's a free training. And we just won a national achievement award for that dementia friendly training program. So we're really proud of it. And we have trained over 2,000 first responders. And so, I mean, we go into fire station kitchens, and of course with COVID, that pretty much shut all that down. But we are developing our current curriculum. We're going to make some improvements to it, and we're going to make it virtually available by January 1. So, And so with the PANDA grant, that gave some additional funding where we could kind of spread the wealth. So all the other 12 AAAs will be providing the training to their first responders. So it's just the PANDA grant. I can't say enough about Jennifer and her team. I mean, serving 90 clients just that quick of a turnaround. And it did take us the first 6 months. We had to show the federal government who provided ACL, we had to show them that we had a really solid plan and implementation phase. We do need to sustain this grant and this project. And so, again, if you just know somebody, they don't have to have a diagnosis. If you know somebody that is at risk of any form of dementia, and we also put a lot of precedence on serving people who live alone with little or no support, who have some form of dementia. So please just reach out to Jennifer, reach out to our agency, and it really can make a difference for the recipient and also for the caregiver. So, so is there any other questions? Jennifer, can you put I guess I could put the link for the CEUs. And it's there on the screen. They must be completed. The survey from Carlette Smith at Human Resource Options, they must be completed within 24 hours. So please visit her website there, copy that link. And, you know, if you have any questions, you can always email me. And my email is rjames@m4a.org, or I'm going to bring Carlette's up. You can always, there's Carlette, it's with a C, Carlette C. Smith at bellsouth.net. Okay, and then just a reminder that our next class will be Matt Maples, who's one of the PANDA partners. He's oversees the city of Pelham's community paramedic program. He's gonna give a presentation on how to manage a chronic medical condition and what he sees as EMS, you know, in the field, working with patients, and he's gonna cover a lot of COPD on that. And then Margaret Grubik, she is the project director of, it was a separate federal grant we got almost 3 years ago, Living Well, Alabama, which is the evidence-based chronic disease self-management program. And that was statewide through the Alabama Department of Public Health. And they did not sustain Living Well, Alabama. So M4A applied for the grant. And we do cover Jefferson County. And just recently, Living Well, Alabama is now, it can be, you can take it in the luxury of your own home. We have virtual workshops. And so if you have any questions about that, I encourage you, it is evidence-based, so it's proven to work. And we have a standalone website for that, and it's www.livingwellalabama.org. So please visit our other website for that program if you're interested in that.
Hey, Robin, I also wanted to share that as part of our grant, we're also partnered up with another program at M4A called Alabama Cares, and we have been presenting coffee breaks every other Wednesday afternoon. So we do have one this afternoon, which we will be highlighting a website called TrueAlta, which is a great resource for caregivers. It gives a lot of educational articles and videos, and you can learn all about that if you want to join us this afternoon at 1, and you can find out how to join us either on our website or on our Facebook page.
Great. Okay, everybody, are there no more questions? Miller, do you want to add anything or?
No, I just want to thank you and Jennifer again, Robin, for including me today. And I did put our contact information in the chat box. So if you are interested in learning more about the work that we do, please visit our website or give us a call.
Okay, well, thank you everyone so much, and we hope to see you in 2 weeks for our next class.